In this work, we introduce the application of computational topology in cardiac trabeculae segmentation. We demonstrate how topological prior could help in solving this challenging task. Specifically, we use persistent homology to identify these fine topological handles and compute the optimal representative cycles of these handles in order to accurately capture trabeculae structure. Cardiac image segmentation is a crucial step for the clinical study and diagnosis of heart diseases. Cardiac images are 3D scalar functions. From each image, we extract a two-manifold representing the cardiac structures. On the left, we show one slice of a cardiac image. On the right, we show a segmentation result. The segmentation task is non-trivial. Simply thresholding and taking an isosurface will fail because of noise. We have to develop advanced image segmentation methods. One major challenge in cardiac segmentation is the extraction of trabeculae, which are prevalent within ventricles. Trabeculae are fine muscle columns whose ends are attached to the ventricular walls. They play an important role in cardiac functionality and are critical in estimating volume-based metrics. Accurate segmentation of these structures is of great practical value and can be used for blood flow simulation, diagnostic measurement, functionality study, and so on. On the right, we show the interior of a beating heart. We can see trabeculae of different scales are moving. These structures are extremely hard to segment due to noise and motion blur. Trabeculae segmentation is challenging. These fine structures are very hard to be distinguished from noise. As we can see, simple thresholding and advanced segmentation methods are not sufficient either. State-of-the-art segmentation methods usually employ a smoothness prior, which enforces the final result to be globally smooth. However, such prior smooths out both noise and trabeculae. Designing methods specifically targeting these structures is difficult because of a large variety of geometry and intensity. We need a method that can detect these structures in an adaptive way. In this work, we demonstrate a topological method which is able to identify trabeculae handles adaptively. Then we just incorporate these handles into the final segmentation results. Here is the segmentation workflow. First, we need to collect the 3D CT image data. Second, we pre-process the images, like closing up to the left ventricle and enhancing the image. And then apply classical advanced segmentation technique to the CT image. Next, we apply persistent homology to the image. The dots on the persistence diagram correspond to potential topological handles. We select the salient handles by thresholding on their persistence and applying a train classifier. Here we show the two blue selected handles. They are optimized to be the shortest based on A* search strategy. Finally, we incorporate the handles into the initial segmentation result and capture the trabeculae structure successfully. In this way, we are able to reconstruct the trabeculae structures. Here is the comparison result between the classical segmentation technique and the topological method. The topological method captures the trabeculae that are missed by the other method. We demonstrate the segmentation results on real cardiac data. We show the reconstructed 3D mesh of standard segmentation method, segmentation with topological prior, and segmentation with optimal cycles. We observe that topological prior helps us capture the trabeculae structures, and optimal cycles provide accurate description of them. These detailed topological and geometrical features of the segmentation results can be used to characterize different regions of cardiac surface and can be used for analysis and diagnostic. In practice, we acquire a time sequence of cardiac images over a heartbeat. We segment the image with the most relaxed heart, in which trabeculae are most separated and easy to extract. Next, we deform the surface through the remaining images and acquire the surface of a beating heart. One new challenge is that we observe that the trabeculae are not always correctly deformed. To solve this issue, we plan to further develop topological priors for the time sequence. The beating heart model can be used to simulate cardiac blood flow, which will be useful for further analysis and prediction of the risk of stroke. Please find the code for localization of persistence on the author's homepage. These are the related publications. Thank you for watching.